Eric, you had mentioned like the importance of mind, body, soul, which I try to preach in my clinic as well. Um, and I just, we have a lot of resources, but it never seems like enough. So obviously, there's so much that comes with a cancer diagnosis, emotionally, socially, physically, you name it. So what resources are you typically offering your patients or advising um outside of, therapy?
Yeah, first of all, I won't discount therapy. I think it's really, really important. I did an interview maybe a couple months ago with a colleague of mine at my institution who's a psychiatrist here, and we talked all about mental health and how we actually need to normalize this, especially for patients with cancer. I really like the analogy that she gave where we go and get our routine dental checks. Why don't we get routine mental checks, right? Like, honestly, why is there so much stigma around this? There really should not be. And so, yeah, my patients probably get sick of me saying mind, body, soul, but it's so, so important because we're always so focused with in the science when before we bring it to clinic, what are the Kaplan-Meier curves showing? What are the statistics showing? What are the hazard ratios showing? Okay, great. But what does that actually mean about the patient that's sitting right in front of you, that's sitting right across the room, right? Like that's really who we should be focusing on. And they're just not this person where we're looking at the scans and we're so focused on the scans. There's a story behind the scans, right? They've got to get home to their families. They have a lot of other responsibilities to juggle, and quality of life matters just as much. And honestly, as a community, we're still learning about patient reported outcomes, quality of life outcomes, how to study these, how to really make sure that we're thinking about all of this. Because let's face it, in the lung cancer world, survivorship is a new term. I'm actually putting together a grant right now about survivorship for young onset lung cancer. And it's like this novel term because one, we don't even know much yet about young onset lung cancer. And two, hearing this word survivorship for these patients is something new. So we almost have to think 20 steps ahead, right, for these patients. What are we going to do in terms of how we sequence treatments? What's the best treatment to start them off with? Yes, to have more time with their families, but also to make sure we preserve their quality of life. So yeah, that's just my general thoughts and my general spiel from the start.
I love that mental checks and dental checks. That's so cute and so appropriate.